The Introduction to Behavioral Sciences, PSY 2415. So, first thing first, it is important to understand your behavior. It is also important to understand the behavior of the patients that you are dealing with in the hospital. So for you to be able to do that, you need to make sure that you know this course. Because minus that is why you see some nurses, they are harsh on patients and everything like that. So behavioral science is going to be a discipline that deals with human action. Okay. So the science of human behavior is what we call behavioral science. And in behavioral science, we are concerned with studying observations and explanation of human behavior. Why is it that this person out of everyone else is behaving like this? That is behavioral science. Now, what is psychology? Imagine you are seated in a restaurant, you are eating, and then you just hear that the person who is seated next to you is a psychologist. Let's interact. What will come to your mind? What are you going to think? What will come to your mind? Be free to. Okay. So let's be free to talk so that you get some sense from this course. This is how we learn this course. It's not like anatomy, it's not like physiology where you need to be listening and listening. You learn more by getting to speak. Imagine you are seated, you are eating, and then you hear this one is a psychologist. What are you going to think about? What are you going to think about? Like what do they handle? Or anything that you think about in that case. You are free to open your mic and speak. Nothing? Okay. So the word psychology comes from two letters. I mean two words in Greek. Psyche, which means soul, and logos, which means to study. So it is more like the study of the soul. Psychology is defined as the study of the mind. So you want to study the mind. But the question is, how are you going to study the mind? Okay, and what is the mind itself? So the mind is what can describe and explain the state of consciousness or the sense of consciousness. Being conscious is doing things that you know that you are doing. Actually, the majority of the things that we do, I'll call you please, I'm in a class. Okay, so the majority of the things that we do is actually unconscious. In other words, we do not know that we are doing them. That is the meaning. Okay. Unconscious behavior is where you are doing things you don't know. For example, every time that you are walking, you might not know that you like touching your chin. So that thing you're doing is unconscious, right? Psychology is a scientific study of behavior and mental processes. So if you look in the definition of psychology, there are three key terms. There is science, there is behavior, and there is mental processes. Now, what do these terms mean? Psychology is a scientific study of behavior and mental processes. So, psychology is a science because you are going to use systemic methods to observe, describe, predict, and explain behavior. In science, science is based on seeing what is happening. So, also with psychology, for you to know what people are doing, how people behave, you are going to use certain methods of observing, also describing, and then you can predict how a person is going to be able to behave. Okay, so there are certain methods that you can use. That is why we say psychology is a science. And then behavior is just action or reaction of an organism in relation to the environment. Any form of life activity, that is behavior, what you do. Everything you do that can be directly observed is behavior. Behavior can be conscious or unconscious. Conscious behavior is things that you plan to do. Okay, I want to start eating now. So you get your plates, you start eating. There are some things that you don't even plan to do. You just do them. Okay, for example, when you are walking, you don't plan that my hand should go forward and then behind and then forward and then behind. It will just be happening by itself. So that is behavior. Or maybe every time that you talk, you like holding your hair. You don't plan on holding the hair, but maybe you planned on talking. So that is unconscious. And then mental processes will refer to thoughts, feelings, and motives. Motives is what is making you to do something. What are you thinking? What are you feeling? Okay, and these are mostly experienced privately because it's only you who is aware. They cannot be observed. Thoughts are real even though we can't observe them, and they really affect the way people behave. Some people, because they are thinking a lot, when you just approach them, they'll answer you anyhow because thoughts are real. They affect how people behave. So human behavior can be influenced by a lot of things, including culture. In some cultures, some people don't do some things because they don't believe it's right. In some cultures, people dress in a certain way because that is their culture, right? And then also emotions. Emotions can also dictate what you do. If you are happy, you behave in a certain way. If you are not happy, you behave in a certain way also. There's also rapport. Rapport can also influence behavior. What is rapport? Rapport is just a close and harmonious relationship in which people or groups concerned understand each other. It's just being able to understand each other like that. Being close and in harmony with people. That is rapport. Okay. So, for example, you can say she was able to establish a good rapport with her children. She's in harmony. She is close to people. And then also attitude, the way you get to interact, the way you get to associate. All this can affect your behavior. Now, behavioral sciences did not start until the 19th century. In the 19th century, people thought this is when modern medicine started to develop. So, in the 19th century, people were able to see some kind of physical manifestations which were causing disease. Okay, for example, in the 19th century, they knew that this person is not physically ill, like they don't have any condition, but then they are not okay. Why is it that this person is not feeling fine, but then there is no sickness in them? So in the 19th century, they only believed that there should be some medical problem for you to have a physical manifestation of something. But in the 20th century, that is when it was understood that actually, when something is wrong with your mind, If your mind is not at peace, your body can be affected. That is why if you think very much, you start developing symptoms. You start feeling sick physically just because of thinking. It's not like there's a condition or something. Just because your mind is not in a proper state. So your body starts also feeling not okay. So in the 20th century, a mind and body relationship was described. In the 19th century, they never understood why some people have got some sicknesses which they cannot explain. It's actually the mind, right? So there is a biopsychosocial model of health and illness. In the biopsychosocial, there are three words here. There is bio, there is psycho, and then there is social. So this is a comprehensive framework that considers the first factors influencing health. In other words, what determines your health is not just your physical well-being, also your psychological well-being, also your social well-being. So these three factors will determine if a person is okay or not. Biological factors will include like the genetics, okay, biochemical balance, physical health, about things that the physical environment. These determine how well you are. Also, the psychological factors, your mental health, how you are thinking, your emotions, your behavior. These are also going to be able to affect how you are going to be health wise. Also, social factors, for example, your cultural beliefs, your culture, your family, your social status. Also, these things will determine your well being. So, to be a health person, it's not just about the body, it's also about the mind and also about how you interact with people. Okay. So bio in the biopsychosocial the biological things include things that can cause disease, including viruses, bacteria, lesions. These are just like there's just something wrong. That's a lesion. And then psycho. This has to do now with the mind, the beliefs, the way you cope with the environment, stress, and then now there's social, the way you get to interact. For example, your class, your employment, your ethnicity. These are all going to affect how well you are, right? Now, what is the role of behavioral sciences in medical practice? Why should you know about behavioral sciences as you are studying medicine? One, behavioral sciences is going to help you to understand the cause of illness. Why is it that some people are sick but you cannot see the cause? It can be the mind. Okay, also the presentation of illness. You know that, okay, even if this one doesn't have, we have not seen anything wrong, but the way they are presenting, there should be some kind of illness. It will also help you understand how to deliver healthcare, because it's not every treatment that needs medicine. Other treatments needs counseling. Behavioral science is also important in medical practice for planning, for healthcare assessment and treatment. For you to plan on how to assess some conditions and how to treat some conditions, behavioral sciences is necessary. It also plays a role in patients' behavior and treatment compliance. You can only, that some people refuse to be treated because they are afraid. Okay, so if you know how people behave, you'll be able to know how to speak to them, and then they are going to be compliant. They are going to agree to the treatment. And then also psychological tests are going to help in diagnosis. These tests that work on the mind, they'll be able to help in finding out the cause or what is wrong with a person. They also help in communication. So behavioral science is necessary in that if you know behavioral sciences, you'll be able to communicate with people rightly. You'll be able to communicate with patients, and you'll be able to know how behavior changes for different people. So you'll be able to tolerate different people like that. Behavioral science is also necessary to understand the uniqueness of individuals. Why is it that this one is behaving in this certain way? This one is also behaving in their way. It is also going to help in creating a doctor to patient relationship. Okay, the doctor can interact with the patient in a good way because the doctor understands behavioral sciences. So if the doctor does not understand behavioral sciences, then there's going to be problem because you're going to be handling patients, some who are educated, others that are not educated and such. So if you do not understand, it might be a very big problem. Okay, so there are some terms that you need to understand. There is what is known as behaviorism. Now, this is just a psychological approach which focuses on observable actions. So when you say these are behaviorists, they depend on observable action to learn on things, also scientific and objective methods. Okay, there are some things that they put for them to learn something. For example, you want to learn the way people behave, so you try to do something so that you observe the way they are going to be learning. And some key important things that you use in behaviorism is stimulus and response. Some people will not do some things because they are afraid of what will come out. So the stimulus is what is preventing them from doing something. The response is what they are doing. For example, there is what is known as conditioning. There's classical conditioning and operant conditioning. If you remember in high school, you learned in biology of Pavlov, that man who got a dog. Every time he brought food to the dog, he was ringing a bell. So the dog going, started panting even when there was no food, but the dog just hit the bell because the dog was now relating a bell to food. Okay, that is classical conditioning, where something that is neutral is associated with, you get to learn a behavior that is naturally neutral. You relate it to something. For example, a bell doesn't mean food, but some of us, every time you hear a pot, you think of food. Every time you just see, let's say, water on a brazier, you go and get mini meal, you start cooking, even if it's water to bath. So you have learned that. Operant conditioning is where behavior are learned through reinforcement. For example, someone drinks beer. Now you want them to stop drinking beer. So what you do is you put something in beer that they hate, such that every time they take that beer, they vomit. So they start getting to be afraid to take beer because of the outcome. That is what we call a reinforcement. Okay, so this is behaviorism. It depends on observation. There are also those we call humanitarian or humanistic. Humanism, this is a psychology that depends, it emphasizes personal growth, self fulfillment, and the value of an individual. So it is all about yourself, how you can grow, how you can fulfill yourself. You need to make sure that at least you have self fulfillment. If you are doing something, you are content with what you are doing. Okay, so that is the humanism. Okay, so that is it. Let's try these questions. You'll be telling me what the answers are going to be. Behavior refers to any of the following except these are exam questions, and you are more likely to find them in your test one. Behavior refers to any of the following except writing a test, jumping a furrow, walking to town, planning a walk. Which one of these is not behavior? You can open your mic and speak. Okay, so planning is not behavior. You are planning, you are not doing. The rest of these are behaviors. Behaviorists are to external environment as humanists are to. So as we already said, behaviorist, external environment, humanist is about personal growth. Human behavior can be influenced by any of the following except how well one knows someone, one's ethnicity, one's stature, if one is anxious. So anxiousness will affect your behavior. That's why some people get to panic. They end up behaving in a certain way because they're anxious. Ethnicity, where you come from, also determines how you behave. How well you know someone also determines how you are going to interact with them, but your stature, your height doesn't determine how you behave. The discovery of the influence of psychological factors giving rise to the biophysical model of illness was emphasized in the 19th century, 18th century, 20th century, 21st century. So, about the discovery of influence of psychological factors giving rise to biophysical model. Psychological, why is it that something things happening in the mind can cause a sickness on the body? That was understood in the 20th century. In the 19th century, they never understood about the mind and body relation.